I'm Sharon Chang, and today on BizTech Health and Wellness, I will be speaking to Professor Dr. Philip George, consultant psychiatrist and addiction medicine specialist at International Medical University, Malaysia. Welcome to the show, Dr. Philip.
Oh, thank you for having me, Sharon.
Okay, Dr. Philip, mental health issues have been something everyone is talking about lately, yeah, because of COVID-19 also. I think it might have escalated cases, all right? So, but it also has been described as a parallel crisis to COVID-19. What is your view on this, Dr. Philip?
Yeah, well, actually, mental health is described as the shadow pandemic of the COVID-19 crisis, and it
Okay.
brings wide-ranging adverse mental health consequences to every individual. In fact, Dr. Victor Seng, who's an acute care physician in the US, describes it as the fourth wave of the pandemic. With more cases of COVID-19, the demand towards mental health services is likely to increase during and even after this pandemic. In fact, the WHO has called on governments to increase investments towards mental health services and programs. I personally have seen an increase in number of cases in my practice, and there have been unpublished reports of increased suicide as well. The factors are numerous. I mean,
Okay.
one is the fear of contracting COVID and then getting used to the new norm, the mask and, distancing. The effect of having to work from home sometimes can take a toll, taking a pay cut for some people, or even losing a job. And then comes things like domestic relationship issues, having to take care of young children at home while daycare and school is shut down. And then social isolation. This is especially significant in the elderly and the young adults or teenagers. And another factor is not being able to access mental health services during a lockdown as well.
Yeah, but it's always has been a stigma which is not um, discussed. Okay, so I mean, there is a perpetuating misconception as a sign of weakness. Okay, and maybe because of cultural norms or ignorance or discrimination or maybe lack of awareness. So how can this stumbling block be removed so people can actually talk about it more?
Yeah. Well, stigma is that when someone views you in a negative way, and this, of course, can lead to discrimination. So, discrimination may be direct, like someone making a negative remark about your mental illness or your treatment, or it may be indirect, like someone avoiding you or not offering you a job because they assume that you may be unstable or dangerous. So, some of the harmful effects of stigma can include reluctance to seek help or treatment. People don't want to go and look for help because there's so much stigma associated with it. And then lack of understanding by family, friends, co-workers, and others. And of course, fewer opportunities for work, school, or social activities, even trouble finding housing. And sometimes people with stigma, and discrimination can encounter bullying, physical violence, or harassment.
So how do
In
you
fact, I think,
address all this, Dr. Philip?
yeah, so actually, the way to reduce stigma is largely by mental health literacy, improving understanding and knowledge about mental health.
Do we have
I
enough access on this?
Not really, we don't. In fact, I would recommend it being taught in schools. If we can actually build the mental health resilience of our young, our students, we can have a better, stronger population of people, a better mental health resilience among individuals. Of course, case stories and personal journey sharing by celebrities and others can also help demystify mental illness. I mean,
What
there
about the
are people,
government?
well, I think the government has to look at bigger investment in mental health. And the sad thing is the recent budget for mental health services and infrastructure has been reduced for 2021. It was 69 million in for 2020, it's been reduced to 26 million, a 61% reduction.
That is a lot.
So, yeah, it's a huge amount. And as I said, WHO is actually asking for governments to increase investment, but it looks like, Malaysia is doing the complete opposite.
Yes, because in Malaysia, I mean, according to the National Health and Morbidity Survey 2019, right, it
Yeah.
actually showed that the national prevalence of depression among Malaysian adults is around 2.3%, which accounts for about 500,000 individuals, right? So,
Yeah.
I mean, that is quite a substantial number, right? So, I mean, and also on World Mental Health Day last month, the World Health Organization has actually called for greater investment in mental health. But what does it actually mean? What does investment mean?
Well, as I mentioned, I think it's, comes from above all the way down to the individual. So, if governments are going to put more investment into mental health, they reap the benefits. They have better, outcomes, more efficiency, less healthcare utilization, uh, better immunity, and a population that has a better quality of life. So it's a win-win. But also there are things that corporations and organizations can do on their own as well. So corporations can and employers can invest in mental health themselves. I mean, it's important for companies to understand and identify if they have EAP programs, employee assistance programs that cover mental health services, or do they run stress management programs? Uh, it also comes down to individuals, so that's the other investment that we need to look at. How much of our time, effort, and energy is spent on our own mental health? I mean, for example, you wake up in the morning and you brush your teeth.
Mm-hmm.
You're not doing that because you got decay or rotten teeth. It's because you're protecting and building your tooth hygiene, your teeth hygiene. How much do you spend on your mental health hygiene? How many hours in a day do you spend maybe meditating, doing mindfulness exercise, breathing exercises, doing journaling? So there are various things that we can invest in on an individual basis, on a even family basis. Families have the responsibility to build and encourage the family members' mental health as well, and as well as companies and societies, and then the government as well.
Yeah, because I mean, investment is, when you talk about investment, is like a value to it, right? You're putting a value. But how do you actually put a value to it?
Yeah.
How much of investment should you actually put into to invest into mental health? Because
Yeah.
I mean, it all boils down to also accessibility, affordability. So in during these times, especially during the COVID-19, people income has been affected. So affordability might be an issue that it has to be addressed.
Yeah. Yeah. Well, actually, the WHO suggests that Malaysia is in the upper middle income country group, and the mean national health budget spent on mental health in this group is about 2.4 to 3%. But Malaysia in 2021 budget is spending only 0.98% of the, which is the amount spent by lower middle income countries. So it's been reduced from 1.1% in 2020 to now 0.98%. But also these figures also need to be identified in a smaller, in an organization and in a company perspective as well. How much you put into your employees' mental health has a huge return. I mean, absenteeism, presenteeism is known to be reduced if you actually invest in the mental health of your employees. You have programs that encourage better mental health, you have accessibility for their mental health services. All of this will actually improve production, output, and efficiency.
Yes,
Uh,
but but employees, I mean, when it comes to that, employees are not comfortable actually talking about their their own issues, right? So
yeah.
how much commitment actually to mental health begins at the top of the management of the organization?
Well, actually, a healthy workplace can be described as one where workers, managers, they actively contribute to the working environment by promoting and protecting the health, safety, and well-being of all employees. So there are three areas that need to be addressed. One is protect mental health by reducing work-related risk factors. So if you're working in a dangerous sort of environment, every day you are worried about being hurt, or something happening to you, or you don't have proper mental health, your work is going to be inefficient. So that's the responsibility of the managers and the employers. Of course, the second is promote mental health by developing positive aspects of work and strengths of the employees. How we approach them, how we communicate with them, all that will also determine whether they feel positive about their work, and that will definitely contribute to better outputs and what do you call efficiency as well.
Yes, of
and
course. I mean,
and
it
then
will
of course,
increase, yeah, if, of course, it will
yeah,
increase productivity, I mean, at the end of the day, but are
correct.
organizations, are companies doing enough for their employees?
Yeah, well, sadly, I think no, I don't see there's enough being done. I have patients who come, and if they have a mental health problem, they are scared to tell their employers, they're scared to tell their bosses, because they're worried that they may lose their job, even though it's a disorder that can be treated and they can recover 100%. If they work for a multinational company, it may be a bit different, because multinationals sometimes have a better perspective of mental health. And sometimes when they open up and tell their bosses even reply that, I've been there before myself, I know what you're going through and I can support you. So, I think we need to realize that mental health is an illness. It's not some taboo or something that, people did to you, or some jumpy and all that sort of stuff. It is a real illness, just like heart disease. If your worker or your employee has a heart disease and you support them and help them through their illness, why don't you support them when they have a mental problem?
So what are the signs actually or symptoms of people showing mental health issues?
Well, many people have mental health concerns from time to time, but a mental health concern becomes a mental illness when the signs and symptoms cause, stress and affect your ability to function, when it's affecting your daily functioning or affecting social interactions and relationships. So first, you need to realize there's a difference between mental illness and mental health. Mental health is what we all go through. We have good days, bad days. Maybe your boss said thank you and you feel so good, and then after a while he says, no, I'm going to cut your pay, you feel down. That's, it's not an illness, it's the emotional roller coaster that everyone goes through.
But can it lead to mental sickness?
Absolutely, yes. Yeah. So if it is consistently poor, then it can trigger mental illness. But we do also know that poor mental health, like feeling stress all the time, can also lead to hypertension, diabetes, cancer, and other medical problems.
Okay.
So it basically reduces your immunity, and you can develop a mental illness or a physical illness. And if it's a mental illness, then there are numerous symptoms, but some of the common ones are sleep and appetite problems, changes in mood or increased irritability and anger, negative thoughts or reduced energy and low motivation, inability to focus, concentrate, think clearly, and also unusual behavior or experiences.
Okay, so now, I mean, with modern technology now, right? I mean, it has also, and also because of COVID, it has enabled
Mm.
doctors to consult patients remotely. okay, using,
Yeah.
I mean, with the adoption of telemedicine services. So can your type of consultations be done remotely?
Yes, they can. Some of my colleagues have embraced online therapy and provided sessions online. So, we have in mental health, among mental health professionals, we have psychiatrists, psychologists, counselors. There's a big difference between all three. So largely, psychologists have embraced this more, and also counselors. Psychiatrists, I have a few friends who have started or done this, but I am a bit skeptical because as a psychiatrist, I'm a doctor. I need to
Mhm.
also examine. I need to also observe physically, because there are medical problems that can mimic mental problems. There are mental problems that can actually cause medical problems. So I need to also, be able to touch, feel, see, and read body language. The other issue is, of course, confidentiality, being online and all of that, and ensuring that no information is going to be leaked. So I'm a little skeptical about that. Yeah, so I personally have not started any online, but I know others who have.
I see. Okay, Dr. Philip, is there anything more that you would like to share?
Well, I think it's good that you are highlighting this, the mental health of individuals and people around the world, especially during this COVID period. Because it's actually an issue that's affecting everyone. In fact, some of my patients actually tell me, doc, I don't feel so alone because now everyone is anxious. Even if you don't have a mental illness, you're anxious about, did I bring my mask? Am I going to get fined 1,000 ringgit? Am I, can I get through this roadblock? Am I going to contract COVID? So the anxiety is everywhere. And I think we need to now spend time to do an audit and see, are we spending time to build our own mental health resilience? Because if we let this anxiety proceed and continue and add another problem like you got a pay cut, you're going to, fall into that trap of a mental illness or a serious, continuous medical problem. So you can help prevent this. And that is by taking mental health seriously.
I see. So if patients comes to you on this aspect, so what do you
Mm.
tell your patients? What do they need to
Yes.
do?
Yeah, so I actually give them a list of different things that they can consider. Of course, there's no shoe that fits all. They have to see what they feel comfortable doing. But as long as they come up with a plan, an idea, and then review from time to time and see if that's helping, I think that's the best way to go. So that's where I'm happy to share this article that we wrote about managing your mental health during this pandemic as well.
Okay. Thank you so much, Dr. Philip. I have been speaking
Okay.
to Professor Dr. Philip George. For more business and technology conversations, go to www.biztech.asia.